Antegrade ejaculation, semen shoots out of the penis. Retrograde ejaculation, semen shoots backwards. Into the bladder.
I didn't even know that was possible.
Welcome to Uncomfortable Questions.
What's up, everybody? Welcome to Uncomfortable Questions. I'm your host, JC Mendoza, and with me, as always, is the #1 board-certified urologist, Dr. Peter Stahl, SVP of Men's Sexual Health here at HIMSS. Dr. Pete, how you doing? I can't think of another person I would rather be uncomfortable with than you, Dr. Pete.
Yeah, I'm psyched to be here and really interested in today's topic. What's it going to be?
I am very interested, and I feel like you could see on my face a look of horror. This is one of the scariest things I've ever read. It says retrograde ejaculation.
Oh man, that's bad.
That doesn't, well, you can't say that. Don't do that because I'm having real problems over here. Anytime I hear retrograde, it's a trigger word for me. So if the planets are involved in my ejaculation, I feel like there's a big problem and I don't like it. What is it? What is retrograde ejaculation?
All right, so to be really simple, it's backwards ejaculation. When a man ejaculates, semen's supposed to come antegrade, forward, out through the front of the penis.
I'm familiar with that.
But if things go wrong,
right,
sometimes it can go backwards into the bladder.
So, all right, so retrograde ejaculation is the semen shoots the opposite direction that it's supposed to. How is that dangerous?
It is absolutely not dangerous. So, it turns out that ejaculation is actually like pretty complicated and delicate. A lot of things need to happen in like an exact and precise timing sequence.
Really?
Climax happens, right? But then the testicles, the epididymis, and the vas deferens, which is the tube that connects them, has to all sort of contract to push the very small amount of fluid that actually comes from the testicles in the right direction. And then organs called the prostate and seminal vesicles also need to squeeze at exactly the right time. The urethra needs to open up and the path backwards into the bladder needs to close. Retrograde ejaculation happens when the timing is messed up or when the bladder can't close off properly.
Right. So when everything is not working in like perfect synchronization, retrograde ejaculation might be something that happens.
That's exactly right.
I did not know that all of that could happen. So like, how do you know that that's happening to you, retrograde ejaculation?
Yeah, so it can be complete or partial, right? Okay. So orgasm is the same, feels just as good. That whole climax sensation is all there. But in retrograde ejaculation, if it's complete, you're shooting blanks, right? And if it's partial, some of the semen comes forward out the penis, some goes backwards in the bladder, and that manifests as low semen volume.
Right, okay, got you. Would you feel it shooting back up inside of you? Because that sounds like it would feel like something.
Yeah, no, you absolutely would not. The only thing you might notice is the first time you pee after you ejaculate. It might look a little cloudy.
Are there any other causes of
so like, why does that timing get messed up, right? So diabetes is a common disease where nerve problems develop, and those nerve problems can affect the precise coordination of the ejaculatory reflex. Some people that take certain medications, like very commonly prostate medications that make it easier to pee, they work by relaxing the prostate. And about 10% of the time when people take medicines for their prostate called alpha blockers, they develop ejaculation problems, including retrograde ejaculation.
So it might make it a little easier to pee, but a little more difficult to not have a retrograde ejaculation.
Yeah, and that like really freaks some people out.
Yeah, I can imagine.
The other thing that causes it is if you have surgery to actually like open up your prostate, you can kind of permanently mess up the ability to block off backflow into the bladder during ejaculation.
What kind of treatment can you get if you are experiencing retrograde ejaculation?
So if you're taking a medicine that's causing it, switch to a different medicine that doesn't cause it.
That's fair.
In the other cases where it's a nerve problem or it's post-surgical, there's really nothing you can do.
Yeah.
There are some medicines that you can try called sympathico-mimetic medicines, which is like a fancy way of saying medicines like Sudafed that kind of like tighten muscle.
Right.
Sometimes those work. You can take them before sex and that can increase semen volume and prevent backflow.
Right.
But in my world, it comes up in two situations. One is someone's just like bummed that their ejaculation volume is not the way it looks in the movies or what it used to be.
They're not putting out what they feel
and that's
like
a tough conversation sometimes because there's not that much you can do about it. It also comes up when people are trying to have kids. Obviously, if everything's going backwards, nothing's coming forward.
That's tough.
But you can actually have someone pee afterwards, collect their urine, take the sperm out of it, and use it to help them have a baby.
And that's good to hear. But that's why we have Dr. Peter Stahl here to make sure that we know that it's going to be okay. So retrograde ejaculation, not scary, just semen going backwards. But one thing that's not going backwards is your knowledge and these uncomfortable questions. We're going forward. We're giving you more uncomfortable questions. This has been Retrograde Ejaculation with me, JC Mendoza, and Dr. Peter Stahl.